Mexico, Bianca is the proud daughter of a Mexican immigrant mother and a first-generation college graduate father. With more than 13 years of experience in healthcare, she has dedicated her career to advancing health equity and dismantling barriers to care for communities across New Mexico. Bianca holds a BA in Mass Communications and Spanish from the University of New Mexico and a master's in public health from New Mexico State University. She is currently pursuing her Doctor of Public Health at San Diego State University with a focus on executive management and community-centered care. As a founder of Luminar Health NM, Bianca works to strengthen and sustain the community health workforce by building the infrastructure often missing for community health workers, doulas, and lactation consultants. Her work centers on credentialing, contracting, mentorship, and business support, ensuring community-based providers can thrive within systems that were not originally designed for them. Bianca is a proud mother, deeply committed to building a healthier future, not only for her own family, but for all families. She believes access to healthcare should never be a privilege, but a fundamental right, and she works every day to make that vision a reality. So with that, Bianca, welcome. Feel free to bring your slides up at this time, and you can take it away from there.
Thank you so much, Amanda. Awesome. Thank you, everybody. And thanks, Amanda, for the introduction. I'm going to share my screen. So it looks like we have a small but mighty group here. So we will, if we need to be a little bit more informal, if you have more specific questions, or if you want to just come off mute, please you're welcome to do that. So I also know we're recording this, so I will also keep that in mind. But before we get started, I just want to know a little bit about who's in the room. And so I see one familiar name. So thank you so much for joining, and it's good to see some faces. But just going to ask a couple polling questions. If you've never used Slido before, it's pretty simple. You can do it on your phone. You just do the QR code and type in the code that's on the screen. I'll give you all a second to do that. But really, this first question is around what's your current role? And so I just want to know a little bit about who's in the room, whether you are a primary care provider, maybe you work in administration, maybe you are a community health worker, a doula, or a lactation provider wanting to learn more about how you can get integrated to these care teams, or are you a CBO? Perfect. So for those of you who are with the community-based organization, I might pick on you later and ask kind of where you fit in this continuum of care as we go through the presentation. Next question here are, what are some barriers that prevent your patients or clients from accessing maternal or preventative services in your community, in your opinion? Is it transportation? Is it language barriers? Is it just insurance in general, childcare, rural access, cultural barriers, or other? Or all of the above, right? I probably should have put all of the above because that could also be challenging. Awesome, thank you. And the last one, does your organization or clinic currently refer patients to community-based providers like CHWs, doulas, or lactation consultants? So yes, regularly, no, rarely, unsure. All right. Well, good. So we have a little bit of mixed here, so that's great. Perfect. So thank you so much for doing that. I really appreciate it. It just gives me a better idea of who's in the room and really how to tailor the session. So why are we here today? Why does this matter? So as primary care providers, as healthcare administrators, as community-based providers, right? It's really important that you understand that New Mexico tends to have, higher rates of just health disparities in general. When it comes to chronic disease, social determinants of health. We do see a lot of maternal morbidity, mortality higher in our state than just the national average. We also are seeing some disparities around as well. And so really these community-based providers can serve as this critical bridge trying to touch in the clinic or in a community-based setting. So being able to connect with these community-based providers could also be that extension outside of the clinical space or outside of that community space where they're able to continue care, whether it be for, navigating the healthcare system, whether it's helping with maternal health, also helping with lactation. And so we're going to kind of go through each role and talk a little bit about that. Our main objectives for today are really understanding covered services in New Mexico when it comes to Medicaid. Um, I'll do a little interchanging about like commercial insurance and things like that as well. I don't want to forget that, but it's important to know that New Mexico is a pretty Medicaid state, so I that's where our focus is. But I will talk about some commercial pieces and where they kind of come into place because I do know you may be experiencing clients who don't have insurance or maybe are commercially covered. We're going to talk about each community provider role in detail and really talk about what their role and what their scope is. Um, We'll also talk about referral opportunities. And so, where those opportunities are to be able to send those referrals for clients who really need that extra support to have that greatest impact. And I'm going to talk a little bit about the Luminar Health Colectiva model where we connect patients to community care. And so those are going to be our four objectives for today. So let's talk a little bit about the shift in Medicaid coverage. And so starting in, actually lactation was the first. So lactation became, and I don't have the date in front of me, but they have became Medicaid billable providers way before community health workers and doulas had. So this model has kind of always been there. But really healthcare is evolving, right? We're really trying to go from chronic disease care and management more towards the preventative continuum. How can we support patients outside of the clinic when it comes to more holistic, whole person centered care? And so we're really seeing this small shift nationwide, but also in our state. And so we're lucky in New Mexico where we have these wonderful community-based providers all across our state who could really support our clinicians, our primary care providers, our community-based organizations, and being able to connect these clients to these services. So the three provider types we're going to focus on today are community health workers. Oftentimes in our tribal areas, you will see community health representatives. So when you see community health representatives, it's typically community health workers who are working in a tribal area. So if you see those two interchangeably, it's really the same scope: community health worker, community health representative. Doulas, and so doulas are our most recent community care provider who became Medicaid billable through policy in 2024. So this just happened. Um, Pretty exciting to talk a little bit about how I've seen that really grow and support our populations. And our lactation care providers. These can be lactation consultants. These can be, board certified providers that are in our state, but these are also covered services, Mexico Medicaid. A little bit more detail. Small group, are there any questions this far? Are we good? Any comment or any question in the chat? Amanda, Mario, we're good?
Yeah, so right now we're good.
Recently, last year, they did add Medicare to be as a covered service for this as well, as long as you were obviously, contracted as a Medicare provider, you're able to bill for this service as well. So that's something that was recent. Lactation providers, like I said, this has been active for quite some time. It was probably the first one out of these three that became a billable service under Medicaid. And this is an active preventative service, and they're covered for up to 6 visits a year. And this could be billed under the baby or the mom. And so if you think through your clients who may not have Medicaid coverage, but the baby does, this would also be an option for them to get services under the baby. Doula services. So doula services is the most recent one that came up. This one passed in 2024 under the legislature, so it's been a policy since 2024, and is an active covered service under New Mexico Medicaid. We are working on a larger project to get this doula services covered under New Mexico commercial plans. That's going to take some time, but the Medicaid infrastructure piece really provided that starting point for us to be able to recommend this to our Office of the Superintendent of Insurance of New Mexico to say, hey, this is a service that's data shows that it does have positive outcomes. Let's get this covered for commercial plans as well. So more to come on that. But for right now, for New Mexico Medicaid, these 3 provider types are covered for every single New Mexican that has Medicaid. Any questions with the coverage or anything else?
Bianca,
All
I
right,
have a
so let's just talk a
question.
little bit of, oh, yes, go ahead. Go ahead.
I have a question, and I don't, maybe you're going to get to this, and if so, just let me know. But I'm wondering about like supervision for community health workers, doulas, and lactation consultants or care providers. I am the program director of a home visiting program, and I'm thinking about like whether or not these can be a part of our program, and then what, like I'm going to become an LCSW, but I'm not there yet. Like, is there some other sort of supervision that needs to take place for these to be part of
That
our program?
is a great question. So that is why I actually referenced those LODs there. So if I'm happy to send them to you all. If you want to put your email in the chat, and if you can get it for me, Amanda, I'm happy to send these to you. I have on my file. I don't have to go search for them. But if you read through those individually, especially as like an administrator, that's going to really be your guidebook of like, what do I need to put in place to be able to like staff these types of provider types? And the short answer is not, there's no supervision. The way they wrote these letters of direction is very unique to where they can practice independently, but also under an organization. So what is important from your perspective is to really make sure that that they're following their scope of work, right? So as you build documentation templates and as you hire folks and onboard them, just making sure they stay within their scope, which is really clearly laid out in the letters of direction. So I will email that to you after this call, so you can kind of have a better idea. What you're trying to do is not unique. I have supported a couple organizations who are doing the exact same thing, especially with that community health worker piece. I think it fits really, really well with what you're trying to do. So we can also talk after. Amanda, just for like contingency, I sent you my slides. So like worst case scenario, if I drop again, you have my slides, and then I'll join on my phone if I have to. So I should have, we'll kind of do that if we have to. This is really we talked about scope. So there's a lot of different areas where they can fit into, right? But really what it comes down to is really helping clients and patients navigate the healthcare system. That could be something as simple as translating documents. That could be that helping folks apply for SNAP and for WIC. It could be helping find a provider in their area that accepts Medicaid. It can be health coaching in certain specialties. So I did a training in Luna County or in Silver City last week where we trained some community health workers. So community health workers, like I said, their scope of work is everything related to education, connecting clients to services, but also it could also be, there are some clinical, and I say that very loosely, but maybe if they're trained in checking vitals or checking a blood pressure or helping a client manage blood pressure, that could also be incorporated into their scope of work. And so I really, recommend that you look at those letters of direction in detail to kind of see what that scope of work is as you build programs as well. But their scope of work is very broad. And to your question, Jessica, I believe was the supervision. The Medicaid director for the state wrote a standing order for community health workers, so they would be able to practice independently. And so that's also something really unique that they did from like a state policy perspective. All right, so I think Amanda, you got my slide, so we'll just kind of wait a little bit. I'll talk through, but CHW. So the CHW model has been studied not only like globally, but from nationally. There is a lot of evidence that shows that working with community health workers and integrating them into your care teams,
that it's going to have better outcomes for your clients or for your patients. So it's very well documented. They've also been known to help with reducing ER utilization, right? Because they educate patients on where to go instead of going to the ER. They can help address social determinants of health by connecting clients to resources. They've also been improved to help with chronic disease, right? Because if they're providing health coaching and education on chronic disease management, right, they're going to be able to manage their chronic diseases better. And also it's been shown to increase preventative engagement. So making sure they're getting the mammograms, making sure they're getting their cervical cancer screening, just really providing that extra layer of education. And that's why that role is so important. Typically where CHWs work right now in New Mexico tends to be there are a few in some federally qualified health centers down here in the South. I know in the North as well. Community-based organizations like some home visitor programs have integrated community health workers as well. Tribal health systems have also integrated community health workers or CHRs, and also public health programs. So we've seen in the county level, at the state level, they have CHWs kind of integrated into their system. Thank you, Amanda. We're now, if there's no more questions on the CHW, yep, we're on, right, you can go back. There you go. That's exactly where we are. Perfect. Were there any other questions on the CHW impact or really where we're seeing community health workers? All right, so let's talk a little bit about doulas. And so the doula model is a little bit different. The way their policy was written into law is that they are independent providers, right? I think they were very mindful when they were creating the bill, and also with the doulas advocating for themselves. These have always been very independent provider types. So these ones, as far as integrating, I would recommend partnering or contracting or supporting local doulas in your area or who contracted with Medicaid. Versus, maybe integrating them into a care team as like a full-time employee, only because births don't happen between 8 to 5. I have seen organizations, attempt this model, but it's going to vary between regions and kind of where you are, if you're in a rural area, if you're not. But I do recommend partnering or contracting or supporting local doulas in your area who are contracted through Medicaid for this service. Doulas are able to provide prenatal support, pregnancy support, really between that prenatal and postpartum stage, labor and delivery, right? And so the way that the billing works is they can provide X amount of visits for prenatal and postpartum, and then they support during the labor, and they get a flat rate for that. They're also able to help with pregnancy loss, also reproductive support, their counseling and education, and also termination of pregnancy support as well. So that letter of direction reads a little bit differently, but basically it's in those 3 buckets: prenatal, postpartum, labor and delivery, and then other, which tends to fall under the pregnancy loss, termination of pregnancy, and also reproductive health counseling as well. So doulas are really in a unique role to provide that birth equity and support that we're lacking in a lot of our maternal deserts around New Mexico, and a lot of these counties that don't have support, where that mothers are having to drive, a long time to get to their OB. This is a really good resource for these patients as well. Doula outcomes have also been very well documented from a national and from a global standpoint. But, having a doula in a birth or next slide, Amanda, I'm sorry, having a doula partner in a birth or support a client has been shown to reduce C-section rates, decrease in preterm birth, because they're getting that prenatal support and education, and also that extra education on top of their OB or their midwife. And also an increase in patient satisfaction, just having somebody in the room that is able to support you emotionally, in a tangible way, has really been shown to have higher satisfaction with moms who are giving birth. Really, the most impactful pieces I've seen is those rural communities that have limited OB or midwife support, right? That they're having to travel to Albuquerque, Santa Fe, and to these Las Cruces for care. Having that doula in between is just a really great resource for them. Our indigenous communities are also, if they are able to have doulas who are also part of their same culture, their same community, they also have, better outcomes and better success rates. And just, just in general, being able to have a doula that looks like the client that they're supporting and understands their culture and their needs during this very private, birth time in somebody's life, it has also been very impactful. And so doulas are very unique in that way, right? They're not clinical. They're really there as like that support for the patient and for the client. Next slide, Amanda. So along with doulas, lactation care providers, I have some who have dual roles, right? I actually know a couple who are CHWs, doulas, and lactation providers. So they're able to help the entire family, right? But lactation providers, you typically see those in hospitals, right? They're there maybe when you deliver, and there's maybe a nurse who's certified as a board certified lactation provider. But lactation providers are also in your community, maybe working independently, or maybe they work for an organization. But really their role is to provide education when it comes to breastfeeding, but they're also able to provide support before the baby comes. And so being able to meet with the lactation provider before the baby is born can really provide that trust and education ahead of time. They're able to support with latch and feeding support. Postpartum lactation counseling is very important. And then also any trouble that babies might have, even physiological, right? Maybe the baby has tongue tie, they need a referral to a specialist, that type of thing. And so I think as a home visiting program, Jessica, right? You all are already in the home, right? So being able to connect your clients to these types of providers is just going to add an extra layer of support for these clients, especially in rural areas. Any questions before we move on when it comes to lactation, doulas, CHWs? Any questions? Next slide, Amanda. Breastfeeding, obviously, just their benefits is also very well documented when it comes to protecting immune systems, their maternal recovery, bonding and development, and just from like a systems level, a lot of research has been done that it helps reduce hospital readmissions. It can lower infant rate or illness rates, and also the cost of formula in general. And I know WIC is there as a resource as well, but really just the benefits of breastfeeding and providing that support for lactation is invaluable as well. And so we do know that from not only a national, but also a local standpoint as well. So let's talk a little bit, this next slide, Amanda, let's talk a little bit about where these providers fit into your care teams. And so Jessica, I know you said you work for a home visiting program. Is there anybody else on the call that maybe works anywhere else where these care teams may work together? Anybody work at a clinic or outside of a community-based organization that want to share? I'm trying to think. I think Jessica said she was home visitors. Anne Marie, I know you're independent. Jessica, I don't know or not Jessica, I got the names mixed up. I think it was Jennifer. All right, so really these provider types are not meant to replace each other, right? They're here to be able to work together simultaneously for the same client if possible, or the family, right? And so in this kind of photo, I wanted the patient in the middle, right? Because that's who we're trying to support by integrating them and connecting them to these other provider types that are maybe already working as a team. And so the goal here is really to get these provider types integrated into our clinical system so they're able to work together, which can be difficult, right? Because we all use different electronic health records. We all document differently. We all are in different parts of the state. So how do we connect all of these together? How do we make these referrals? And so, by bringing a community health worker on board as part of your team, right? That's a first step. But it could also be, identifying who are these local providers in your area that you can refer to as like you would refer for a specialty outside of your practice or outside of your organization. So really starting to think through what resources do I have locally? Who can I bring on board into the team and integrate them? What does that look like in your area? And it's going to vary by county, by city. It's going to vary. Next slide, Amanda. So referral or opportunities and when to connect patients. So you might be thinking, well, when do I connect a client? And once I identify that there's somebody that can support them, Community health worker referrals. It could be something as a client of yours said they needed help arranging transportation, or that they mentioned they had a food insecurity barrier. Maybe they need health education for a new diagnosis. Maybe they're newly diabetic and they don't know how to monitor their glucose at home or use their glucose meter. So connecting them to a CHW who's certified in diabetes education would be ideal. Navigating social services, and now with all these Medicaid changes and kind of things getting a little bit more complicated to navigate, a CHW can really be pivotal to make sure that your patient, your client stays on Medicaid, right? Now with like the new work requirements and documentation and all the things that are changing, CHWs can really help maintain eligibility status for your clients who you may rely on for Medicaid coverage as well. So CHWs are a great place for those types of referrals. Doula referrals, right? So somebody who's planning on getting pregnant, somebody who's newly pregnant, somebody who's already ready to deliver, right? Maybe they just want somebody supporting for labor and postpartum. But really getting ready for labor can be a referral. Maybe folks who don't have a lot of support. And so the few referrals I've seen recently come through are parents or families or new moms who don't have family support, right? So having a doula to be able to be there to answer questions and to be there even just in the room to hold space for that client can be a reason for a referral. Maybe the baby already delivered. Maybe the mom's struggling with postpartum, right? And connecting to services and having somebody to support her and ask questions could also be a doula referral as well. So not all doulas have to be there pre, during, and post, right? It can be through any of the continuum of that birth journey or pregnancy journey for that client. Lactation referrals, right? It doesn't have to be when the patient's already having problems. It could be proactively, right, before the mom delivers, so they can get to know the lactation provider, so they can do a home visit and assess for equipment and help them get a breast pump and things like that. But it could also be if the patient is experiencing low supply or just already has pain and doesn't want to stop breastfeeding but really needs direction. So those can be reasons for lactation referrals. And so hopefully that kind of helps understand like when to get one of these care providers involved. But my advice would be sooner rather than later, right? That's the goal, is to get them at the beginning before, there needs to be more intervention or there needs to be more issues. Next slide, Amanda. So I'm going to talk a little bit about our Luminar Health New Mexico Colectiva that we started almost about a year ago. We started this back in April of last year. So almost a year. So it almost feels like a birth, right? Like we've been kind of growing this initiative to really not only support the independent providers on the ground that it's trying to do the work and get connected to these clients, but also helping them with referrals and connecting to care teams and to groups such as yours to be able to create that interdisciplinary team to support the client. And so not only do we help with credentialing and contracting support, because that can be really difficult. If you think about a primary care clinic, they have whole teams that help them with these processes. These independent providers don't have that. They don't have that infrastructure. So we provide that for them. We also provide billing support. And so they have a place to electronically document HIPAA in a HIPAA compliant way as they get referrals, right? We're able to bill on Medicaid as well. Referral coordination. So a big part of what we're trying to do as well is letting care teams like you all know that we accept referrals. And so community health workers are unique where they can see clients through telehealth. So if you have a client in San Juan County and we have a CHW in Albuquerque that can understand the area, we can connect them telehealth. Doulas and lactation, we prefer, actually they need to be face-to-face. So that one's a little bit different, but we're really trying to get connected to providers in every county. So we're able to support everybody around the state. Another thing that we do is workforce development. So just making sure we continue their education. And so they understand like what's new on Medicaid, and if anything else changes when it comes to policy, we're there to also support them as independent providers. Next slide. So right now, like I said, our goal is to have a doula, lactation, and a CHW in every single county. But right now we're kind of spread out across the state. We have some folks in Rio Arriba, Santa Fe, and Taos. We have some in Bernalillo County, Doña Ana County, and also Chavez and Roosevelt County. We have San Juan coming soon. I think one of you also, I think your email said Sierra County. I don't know if that's Sierra County or if that's a different name maybe of your organization, but like I said, if your county is not on this list and you have somebody in need, please still reach out. I'm very connected to especially the doula and lactation space. So I would be able to help either help with that referral or help connect them with somebody in your area that's providing that service. CHWs, the cool thing about them is they're able to provide services remotely through telehealth. So it's just a really good option if a client of yours needs support and maybe they're not in these counties right now. Or vice versa, if you know of any providers in your county that are independently practicing right now that need the support or that would like to join us, please they're welcome to connect with us as well. Next slide. So how it works, right? And so you would, a provider would join our network, we get them credentialed. We already have a Medicaid contract, so it's a quick turnaround. We get them referral ready to start seeing patients. We receive referrals in numerous ways. I'll go through that in our next slide, but really how you can refer to us, we'll go over that. And then we deliver a service and then we close it out, right? Or we continue on the service as needed. So for community partners, you may not be able to onboard or staff these types of provider types right now. So really being able to remove that administrative burden and supporting your clients. For healthcare partners, right, we get them credentialed and all the things for billing, and you're able to send us referrals quickly. Or for those who are independent doulas, CHWs, or lactation providers, we can do that as a service for you as well. And for our patients, right, the best thing for me is to be able to, if I get a referral, to do a quick 24-hour, 48-hour turnaround to say, hey, we got an assigned client, please reach out and make that connection with them, whether it's through text or phone call, to be able to say, hey, we're here to support you in your journey sooner than later. So that's kind of how it works, like just in a nutshell. Next slide is how you connect to us. And so if that's something that you're interested in, you have a client that needs support, we have a few ways to do that. We have just like an old school phone line where you can leave a voicemail with the client's information. It's a HIPAA compliant voice line. If there's a client that needs support, we'll take that through call or text. The other one is online referral form. So our website, we have a referral form where you can complete the referral. We don't ask for any PHI on that. We just ask for the client's name, what service they're looking at needing a referral for, and then their phone number so we can reach out to them directly and we'll ask more questions. We're also in Yes Connect. So I don't know if anybody on this call is aware of Yes Connect or Find Help, but it is our state closed loop referral system. So we're also in there. You can search for Luminar Health and you can also send referrals directly through there. And so we're trying to make it simple to get connected to us, but really there's no right way or wrong door. And so feel free to use any of those ways to be able to connect to patients to us. So just as we kind of wrap up the session here is really, there are coverage out there and it exists. I think we have over 500 CHWs that are certified in the state of New Mexico. I think we're up to almost 70 certified doulas. I don't know how many certified lactation providers, but I guarantee you there's at least over 100 that are certified right now. So the coverage is out there, it exists. And so really finding who those partners are in your community who are providing these services is key. And if you're thinking about extending your team, right, it involves a community health worker. If you need support on how to do that, we're here for that as well. But we're trying to make it easier for these community-based organizations or clinical care teams to connect to these provider types. If they're not planning on hiring them as part of their care team, we're here to be an extension of that. The cool thing about Yes Connect is if you have Yes Connect and we have Yes Connect, we all document in one place. And so you would be able to see kind of what we did with that client. I know Yes Connect is still a relatively new system. And I know that the state is doing a lot of education around onboarding primary care and onboarding community-based organizations on this platform. So we're all kind of connected in this way. I know we still have a long way to go with that. However, that's kind of the first step, is using the closed loop referral system to be able to do that. But in the meantime, right, we can still do it old school with fax and phone call. And so we're still happy to do that as well. Next slide. So I think that was my last slide. We're here to help, whether it's to collaborate or answer questions around how do we integrate, how do we add these folks to our care teams, whatever that might look like, we're here to help. Of course, we're here to support the clients as well. We get referrals, but we're also here to support the community-based organizations and the providers who may be referring to us for their clients who need support. So whatever that might look like, we're here to help. So with that, any final questions or thoughts? I want to apologize for the technical issues. I don't know why that happened. Sometimes I just don't know. Anne-Marie put the winds, and so that it's very windy here today. So that could be why. But thank you so much for your attention. I'm going to get these slides to Amanda. I think we got the email for one of the persons who wanted the letters of directions, but I'll also include those, Amanda. I don't know if you send out notes or things. I can send you out those links for the letters of direction for the folks to have those. But other than that, any questions or final thoughts?
So if there are no more comments, questions, we can go ahead and close out.
Thank you all so much. I apologize for the technical difficulties, but thank you so much for joining.
Thank you, everybody. Have a good rest of your day.